If your Achilles snaps, what happens next could define the next year of your life. Most people assume surgery is the best treatment, but is that really true? Let's get into it. So you may or may not know that after Jayson Tatum ruptured his Achilles, his next stop was an MRI, then an immediate surgical repair. Now, most Achilles ruptures happen in the middle of the tendon, or what we call the mid-substance. It's where blood flow is the weakest and where the tendon fibers are at their most stressed mechanically. However, ruptures can happen other places too, like right off the heel bone. This is where a lot of partial tears actually happen, and up higher where the muscle bellies meet and begin forming the Achilles tendon. And all have different treatments and different long-term outcomes, which we will get to later in the video, because these variants actually happen to a lot of people, and they don't even know it. Usually though, after a rupture, as soon as you feel the back of your ankle, you can tell if it's a classic Achilles rupture or not, because it'll feel like there's a valley there where the tendon should be, and there will be a loss of tension. It feels a lot like a stress ball or like Play-Doh under the skin. So it's at this point most people start asking, if you know where the rupture is, if you can feel it, why get an expensive MRI? Well, the MRI, first of all, gives us a 3D image of the tendon because it takes pictures in small slices from different directions, so you get fantastic pictures. But what those pictures do is show you how much of a gap there is from the bottom to the top of the rupture, which can have a massive effect on treatment. Sometimes even it will look and feel like that Achilles is totally ruptured, but there will still be some fibers hanging on, or it'll feel like a really small gap, but when you see it on MRI, it'll be huge, or vice versa. With injuries as devastating as Achilles tears, all that information is crucial. So back to Jayson Tatum's example, once Tatum has his MRI, his rupture will now get classified into one of a few categories. Number one is a partial rupture, there's still fibers hanging on. Number two is a complete rupture, but that gap is less than 3 centimeters. Number three is a complete rupture, but the gap's between 3 and 6 centimeters. And number four, which you can guess is the one you do not want, is have a rupture and the gap is over 6 centimeters. And so then after you've gotten the MRI and the rupture's been classified, that's where the decision making and usually the arguments start. Because if you look at trends in sports medicine, the school of thought has really shifted back and forth from conservative or non-surgical care to surgical care of ruptures really a few times, especially if you have a weird injury like what I talked about before with the partials off of the heel or those higher ruptures. So with all that being said, at this point, what would actually happen if you decided to not have surgery? And why do some surgeons recommend skipping surgery entirely, even for those with complete tears? Well, to start with, you'd be placed in a walking boot, but not just any walking boot. It has to be tall enough to at least cover the calf. I see so many people in short boots when I'm out and about, and I'm telling you, these do absolutely nothing. If the muscle that is governing the tendon is higher than the boot is doing nothing. It's just going along for the ride. I know they're more comfortable, they're easier to lug around, but I'm telling you, if you've got an Achilles rupture, even a partial rupture, they're doing nothing if they're that short. Now, along with that boot, the next thing you'll get is usually a heel lift at 40 degrees inside the boot to better reapproximate the tendon, to get the tendon ends closer together to aid in your body bridging that gap. This is reduced in angle over about 6 to 8 weeks. And depending on the patient and the swelling, honestly, usually I'm also putting people in a multi-layer compression dressing to stop abnormal swelling. Remember, swelling is a necessary part of healing. You just don't want it to get out of control. And at this point, basically let's play the waiting game. We give the tendon about 2 weeks to begin to heal and the swelling to come down, and then we start physical therapy. And therapy starts pretty light with just isometrics and low consequence rehab. Then over the next 16 weeks, the rehab gets more and more and more intense. And in this scenario, the boot comes off roughly around week 8, and return to sport is anywhere from 3 to 12 months. I know it's a big gap, but remember those numbers because they will be important later. All right, so now let's take the other side of it. Let's say you did have surgery. What would happen? First, you'd still be put into a boot and maybe still a wedge depending on the surgeon, then a compressive wrap because you can't cut through skin when it's overly swollen or the incision will never heal. And if you get to the tendon quickly and decide on surgery quickly, you can get the surgery actually done before the biggest wave of swelling occurs, as was the case with Jayson Tatum. But in a lot of healthcare systems, it's impossible to do this just because it takes time to get appointments, insurance approval, OR time, things like that, et cetera, et cetera. So sometimes it is 2 or more weeks before it's even possible to have surgery, even in the best case scenario. But let's just say for argument's argument's sake, you get your surgery roughly around 2 weeks. After surgery, typically physical therapy starts at 2 weeks, with now roughly the same timeline as non-surgical care at this point, with gentle isometrics first, and then at 8 weeks the boot starts to come off, and with a total of 16 weeks of therapy. And returning to sport, if you're a runner, 3 to 6 months, or court sports or high-impact sports, it's between 4 to 9 months, but it can still take up to 12. So if you've been paying attention, at this point you're looking at the numbers and thinking, wait a minute, there's potential to return to sport earlier with no surgery. And yes, you would be right. Except, most studies still show that you lose 1 grade of strength in your Achilles when treated conservatively. So if your one leg is a 5 out of 5 plantar flexion strength, going down flexion, the other will only get to a 4 out of 5. Now here's the thing, that 1 grade drop usually doesn't impact day-to-day function for most people, and even some recreational athletes can often perform just fine. There are also reports out there that with aggressive physical therapy, it is possible to get to a 5 out of 5 on the injured side, although that's definitely not the consensus. There's more studies saying that you don't get full strength versus the ones that say you can. The other big consideration in this argument, though, is that historically the rates of re-rupture are significantly higher in athletes that are treated non-surgically versus surgically, which is a huge thing considering the toll Achilles ruptures does to an athlete's confidence long term. This is even in a very influential study done in 2010 where they showed that re-rupture rates weren't higher in non-surgical patients so long as they began early active physical therapy. The confidence those athletes showed in their injured Achilles was way less than the people that actually had surgery. So even in the studies that showed that you could rehab back to normal strength with no surgery and no more risk of re-rupture, your brain is still acting like there is a bigger chance. And we all know if you're mentally not there, if you're not in the zone, it's going to throw you off regardless of the reality of the situation. And also on the side of surgery, remember, surgery does allow for more efficient gliding of the tendon after rupture, so that is also a big consideration in higher level athletes. However, surgery in this area also has historically high complications, including skin breakdown, infection, neuritis, things like that. Although with newer minimally invasive techniques, that is actually getting much, much better. But the thing with this whole surgery versus non-surgery argument is, this argument only applies to those ruptures with gaps less than or equal to 3 centimeters. For those larger gaps, yeah, surgery is still the gold standard. You can treat them non-surgically, but if you are an athlete or just want to return to normal activity, it's going to be tough to do that with conservative care. Although there are reports of people doing fine with it, I certainly would want surgery if that were me with a rupture, let's say 5 or 6 centimeters. The opposite, though, could also be said for those other types of tears we talked about in the beginning of the video. Partial tears can easily be treated without surgery. Same for tears higher up and closer to the muscle bellies. And in my office, I routinely treat those non-surgically, with my athlete patients doing fantastic with conservative care. And I would say the reason Tatum got immediate surgery was probably twofold. One, he may have had a huge gap, and yeah, that's just straight to the OR for sure. The other thing, though, is all things being equal, the best chance of a full return to sport with full confidence is still surgery. So if we're playing the odds, you may as well give yourself the best hand. And honestly, this is where my opinion falls too. If the athlete is healthy, can undergo surgery, that's more often than not what I'm recommending to my patients. Obviously not everyone, but like I said, if it were me, it's what I would want too. But I'd love to know what you would want. After seeing all this information here broken down, what would you like? Because I have plenty of patients that go the conservative route. They do just fine too. I mean, I've had pretty good outcomes. I've had people have issues with both sides of the coin. So I'd love to hear your thoughts in the comments down below. And speaking of elite athletes, if you're interested in elite footwork and want to see what goes into the biomechanics of one of the world's most elite clutch shooters, check out this video right here. And if you need to catch up on how exactly an Achilles rupture happens in the first place, make sure you click right here. I'll see you in the next one.